I would like to acknowledge the traditional owners of the land we are meeting on and acknowledge the elders past and present and emerging, as well as any Aboriginal or Torres Strait Islander people attending today. Welcome to clinical placement at Cumberland Hospital. Cumberland is a mental health facility of approximately 260 beds that provides primary and secondary mental health services to the local population and tertiary acute, extended and forensic medical health services to the Greater Western Sydney and New South Wales. Cumberland originally housed female convicts from 1817 to 1847, and then in 1849 the buildings were redesignated as a lunatic asylum. The site has remained as a mental health institution to the present day, taking the name of Cumberland Hospital in 1983. Cumberland is currently part of the Parramatta Light Rail construction project, so care needs to be taken at all times whilst on site. Whilst on placement, you must be aware of your emergency and evacuation procedures. The emergency number is 2222. In the mental health environment, it is particularly important to be aware of Code Black, which relates to personal threat or aggression. Duress alarms are issued to each student and must be worn at all times in the clinical area. General or G keys are issued to students for access to units. For security and safety, this key should be with you at all times during your shift. Any loss of a key must be reported to the NUM or nurse in charge immediately, as the loss of a key is a major security risk. Your student photo ID must be worn at all times at chest level, and your uniform must be worn as per New South Wales health policy. This includes bare to the elbow. Undershirt sleeves cannot be rolled up. In mental health, there must be no ties or cords on jumpers or cardigans, no lanyards, and no scissors, forceps, or sharp instruments in pockets. Observation is an extremely important nursing skill and is vital to patient safety in all phases of mental illness. Students are not made responsible for observing patients whilst on clinical placement. Students must not interact with patients or staff who are on observation levels 1 and 2. Students are not permitted to be involved in any Code Black situation and are not permitted in the patient seclusion areas. And students must never go into patient rooms alone under any circumstance. Mobile phones are not permitted at any time in the clinical area, and students are not permitted under any circumstance to take photographs or enter any details or make any comments on any social networking site that displays or makes reference to any patient or person or identity that could be identified as being related to any patient or work-related activity. Western Sydney Local Health District and New South Wales Health have a strict no smoking policy. Placements will be cancelled if this policy is not adhered to. Your shift information will be given to you on your first day of placement. Shifts cannot be swapped with other students. You must sign on in the daily ward allocation book. Please check with your NUM or team leader. Whilst on placement, you will be under the direct supervision of a registered nurse. This can include casual or agency registered nurses. If you have any concerns or problems during your placement, please contact your facilitator and or your NUM in the first instance. Please notify your facilitator and the NUM or the nursing team leader immediately of any accident, incident, or any near misses that occur whilst on placement. Your facilitator will notify your education provider. An IMS notification must be completed by the student and the ward staff. All students must complete the New South Wales Health mandatory education modules in My Health Learning. Access to electronic medical records will be given to you via your StaffLink number and password. You do not share your login, and you do not use your access to search records of yourself or people you know. All entries must be checked and signed off by your assigned registered nurse. There are no food or ATM outlets on the Cumberland campus. We do have lactation facilities and a masala prayer room. Please liaise with the facility coordinator if either of these amenities are required. All facilities are accessible via public transport. Access to Cumberland Hospital is via the boom gate. To gain access, press the buzzer for security. Parking is currently free, but is limited. We hope that you'll find your placement to be a valuable and worthwhile experience. If you have any questions or concerns whilst on placement, please refer at any time to your facilitator, your nursing unit manager, or your assigned registered nurse. Thank you.